Today we are going to learn about Surveyor. Surveyor is defined as an ideal instrument to determine the relative parallelism of two or more surfaces of a dental cast. Dental cast is reproduction of patient's mouth. There are 4 reasons for surveying cast: to select the path of insertion, to select the retentive areas, to select the surfaces that can be prepared to guide the framework, and to find the surfaces for the retentive arm of the clasp. A surveyor consists of 4 components: cast table, base, vertical part, vertical spindle. Now we are going to learn about 4 tools. First is the analyzing rod. The analyzing rod used to access the cast. Graphite marker. Undercut gauges. They are available in 3 different sizes. You can identify the size of gauge with the marking on it. One line is 0.01 inch. 2 line is 0.02 inch, and so forth. And the last is the wax chisel, which is used to survey the crown. The first step in process of surveying a cast requires one to examine and identify contours of teeth and edentulous ridges of the cast. Now we are going to use analyzing rod. It is placed into the chalk. First, we are going to identify the triangle of light. These are the area of undercut. In order to find desired position between 2 teeth, the triangles should be equal to each other, which is necessary to put denture in position. With the use of analyzing rod, now we are going to make tripod lines. Tripod lines are parallel to each other, which will help to determine the orientation of the cast. You can find this parallelism by tilting the cast. The desired position of the table should not be more than 10 degrees. These lines are made so that the cast can be securely fitted into the table at the same tilt. Tripod lines are marked with the blue pencil. Now we are going to use the undercut gauge. However, There are different sizes available. We are going to use 0.01 inch undercut gauge. They are helped to determine the undercut for retention. We will mark the undercut with blue dot. Now we are going to use the graphite marker to mark the survey line. The widest part of the survey tooth is known as the survey line. After we place the marker, we are going to rub against the tooth. It makes a black line around the tooth. Any part above the survey line is non-undercut area. It's a non-retentive area. Any part below the survey line is a retentive area. The retentive clasp goes into the retentive undercut. Now we are going to find the soft tissue undercut. The soft tissue undercut area are important to determine the path of withdrawal for the denture. We are going to again mark with the black line. These are the basics to determine the removable partial denture design. Thank you for your attention. I hope you will learn something.